Okay. I'm Mayor Pro Tem Delia Garza. We are in work session. We have a quorum. Mayor Adler is out, and he'll be arriving later this morning. Today is February 4th, 2020. We are in 301 West 2nd Street, and the time is 9:06. I'll call our work session to order. The first briefing will be on the coronavirus, so we can have staff come up and give us that briefing.
Good morning. I'm Dr. Mark Escott. I'm the Interim Health Authority for the City of Austin and Travis County. I'm joined by Janet Pichette, who is our Chief Epidemiologist at Austin Public Health. And we're going to provide you a brief situational update regarding the 2019 novel coronavirus. This is something that is changing very quickly and sometimes multiple times a day. As you all are likely aware, this outbreak began with a cluster of cases, 41 cases, on December the 31st of 2019. On January 7th of 2020, that was isolated as this novel coronavirus. In the first report from the World Health Organization, they reported a number of 238 cases, which was just 2 weeks ago. Yesterday, there was a total of more than 17,000 cases. This morning, that number is more than 20,000, with the deaths currently at 425. That's primarily in China. There are some cases, including 11 in the United States, with only one death outside of China. This gives us a mortality rate currently of 2 to 3%. It's about 2.1% for the whole outbreak and about 3.1% for the city of Wuhan. And I'll talk more about that impact in a bit. There are many folks who are asking, why should we be concerned? And the answer is this slide, something we call R0, or the reproductive number of the virus. So we see that seasonal flu has a reproductive number about 1.3, and that is an individual who is infected will likely infect 1.3 additional people. So this 2019 novel coronavirus is at least as contagious as the flu and perhaps twice as contagious, but substantially less contagious than things like measles. The graph that you see on the right is modeling of the actual outbreak. It's hard to see the numbers at the bottom, but around the middle of that graph is when the cases were first noticed in Wuhan City. At that stage, it was likely close to 1,000 cases. This modeling is used to determine the actual impact of the disease rather than the confirmed cases. And that model indicates that the actual number of cases in this outbreak may be substantially higher, maybe 10 to 20 times the number of confirmed cases. So this is a reason why we need to be concerned and why we need to be concerned now. Our real concern for our jurisdiction and for the United States is the uncontrolled person-to-person sustained spread of the disease, which has necessitated the increased measures by the CDC and HHS that happened this weekend. There is some reassuring notes at this stage, and that is that the two person-to-person spread in the United States were spousal transmissions, and that CDC has followed closely individuals who were on the plane with the initial 9 cases that flew into the United States, and there was no spread associated with air travel during that time period. So this does indicate to us that it's really dependent upon close personal contact. Currently, there are no cases in Texas, and that's reassuring because there's not risk of exposure unless there are cases. And it's important for us to remember this and to share this with the community because there certainly is a risk of xenophobia associated with people who are Chinese Americans or Asian Americans, and that is not necessary and inappropriate at this stage. So it's important for folks to remember that if somebody's coughing and they look like they have the flu, there's about a 35% chance they have the flu and virtually a 0% chance it's coronavirus at this stage. So initially the U.S. issued a health alert, and travelers returning into the United States from China were given this card. There was initial screening done for fever, If they had a fever, there was a further medical evaluation, and if they were not sick, they were given this card and allowed to travel, continue travel to their destination. That changed on January the 31st when HHS Secretary declared a public health emergency associated with a presidential proclamation limiting entry to the United States. On February 2nd, that public health emergency and proclamation went into effect, which is going to limit the travel of individuals into the United States. More specifically, individuals who traveled from the Hubei province will be quarantined at or near the airport of entry in the United States, which will be one of 11, and that includes Dallas-Fort Worth Airport. Those who are not sick and only travel to mainland China will be allowed to continue on their itinerary and will be tracked by state and local health departments. At this stage, we don't know how many individuals that will be for the city of Austin and Travis County, but it's probably going to be more than zero. And I'll say that this was an important step to limit the travelers. Usually in the United States, there's about 14,000 people returning from China to the United States on a daily basis, which creates a number of travelers which is impossible for current public health resources to track. So this narrowing down of entry in the United States was critical at this stage to be able to adequately monitor those individuals. So currently the case definition is listed on this slide: a fever and indication of a lower respiratory infection, cough, or difficulty breathing, and that travel history of China in the past 14 days, or a close personal contact with an individual who has been diagnosed with the novel coronavirus. In response to this activity, Austin Public Health and our partners throughout this region have been dialoguing on a regular basis. There's ongoing conduction of syndromic surveillance through an electronic method which monitors healthcare records in our emergency departments. We've been actively involved in fielding questions from healthcare providers, employers, and school districts regarding what to do and how to interact with individuals returning from China. And we've been involved in regular communications with CDC, DSHS, and other stakeholders throughout the region, locally and nationally. We have sent out, if you could go to the next slide. We have sent out health alerts to our healthcare community through the Travis County Medical Society, memos to mayor and council, as well as social media, and sharing information, much of which has been created and shared by CDC and DSHS. In addition to this, we have instituted screening through our 911 system for those with influenza-like illness who have a travel history to China. Prior to moving that individual, there's a consultation with public health to determine if this person has an appropriate exposure risk, and then navigation of that individual following that screening. Overall, the risk is low to the United States, and it's low for us in the city of Austin and Travis County. And it's important that risk stay low. And this is where the community comes in, because this is a community effort, not only for this novel coronavirus, but for flu and other respiratory illnesses. So we are continuing to reinforce the messaging to the public, to our City of Austin departments, and to the general community, that these steps are critical for this and for those other diseases. And that is wash your hands, soap and water if you have it, hand sanitizer if you don't have it, and avoid touching your face, so particularly the eyes, nose, and mouth. The skin is a great barrier to prevent the transmission of infection. When it goes into a mucous membrane, it's much easier. Next slide. The other important thing, and I saw a great example of it this morning, if you cough or sneeze, do so into a bent elbow or into a tissue. We don't want people coughing or sneezing into their hands, because their hands then touch other things, and that virus can survive. We do have indication that this novel coronavirus probably survives a couple of hours, maybe a few hours on surfaces and in the air, but it's limited to that. So it's relatively fragile. And again, sort of like we talked about with Ebola, you can get this on your hands. If those hands don't touch your face, you're not going to get this infection. So it is critically important that we avoid touching the face. and that we do this coughing or sneezing into the bent elbow or tissue. Next slide. The other critical factor is that folks stay home when they're sick. And for 24 hours after they have the fever go away without medication. This is something that we need to reinforce as a city, that we need to encourage employers to reinforce in their workplaces, in schools, and in healthcare settings, because this is how people are more likely to spread this disease. There is some indication that this coronavirus can be spread while people are asymptomatic. They're much more likely to be able to spread it when they're sick. So it is critical for this and for flu that we encourage people to stay home if they are sick. And we're happy to take questions.
Does anybody have questions? Doesn't look like it. Thank you for that presentation.
Thank you.
I have one question.
There is a question. Councilmember Kitchen has a question.
Just a quick question.
Yes, ma'am.
So in terms of putting this information out to the public, how is that happening?
Jenna, do you want to take that?
Sure. So we're trying to amplify the state and CDC's messaging. So we are directing people to the CDC webpage or the state webpage. Again, the state's been having daily situation calls, and so they're staying on message with CDC as we are as local health departments staying on message with the state. So and CDC. So anytime they have information, we try to push it out. And then we have our communications person who can tell you more.
Jen Sant, Communications Manager at Austin Public Health. We, like she said, we're amplifying DSHS and CDC. Because this is happening so fluidly, we are directing people to the CDC site because it's constantly being updated.
Okay. If there's a message that you would like us to get out, I mean I can send this out or write something up from this, but if you have something written, you might share it with our offices. And if we put something in our newsletter, want to make sure what I put in the newsletter is what you want to go out.
And the current plan is to work with CitySource with our employees. I know that we have a memo that we're drafting to go out to city employees. And then on top of that, we have social media posts that we can send to your offices so that you can amplify that.
Thank you.
The next briefing is Census 2020 efforts, and while that staff is coming up,